have a patient at Adventure Dental. He is autistic, and initially when we tried to perform his exam and his cleaning, he wouldn't let anyone look in his mouth.
A patient who was new to the country, had no resources. This patient had a lot of decay and needed extensive treatment.
What she said with her caregiver next to her was that she gets made fun of all the time because of her weight in her group home. And it broke my heart. And she said, I really would like you to hold me accountable when I come to my visits in the future, because I'm going through bulimia and I can't do it on my own.
Well, right now, her father is on hospice, in-home hospice, and we are homeless. She said, we found someone that let us stay in their cellar, in this one-room cellar with a teenage girl, her mom and her dad. You know, I could see the daughter, she kind of sat up for a minute and made eye contact with me. And the most important thing to her right then was her dog, her dad's dog. And he wanted to make sure that she was able to keep the dog.
There was a father who brought his special needs daughter in for a cleaning and for a checkup. We couldn't get any x-rays, which was expected, but we were able to help the father, help her into the chair. Now, she was a bit combative and she began to hit the father. So at that particular point in time, you know, Dr. Amonde and Dr. Gray asked me to come into the operatory, and I actually helped the father to place the patient in a protective stabilization. We had 3 assistants with us.
One of my outreach team came walking from the dental room, guiding a mom and a daughter over to me, and she said, Janelle, you need to help this family, see what you can do. And so I looked over and I noticed that the girl, she was probably about 12 years old. She had glasses, but the frames were cracked, the lenses were cracking. Around the frames, the paint was peeling, and it only had one arm.
I had a little girl once come in, and she had been a victim of sexual abuse, and it was uncomfortable for her to even have anybody in her mouth, and her front teeth desperately needed treatment. And, you know, it was one of the hardest things I've ever had to do, to have a little girl look at me like that, you know, in pain, like they were so scared. But I knew after that day that I was going to be the best I could possibly be at doing that treatment, because I almost don't trust anyone else to have taken care of that patient the way we took care of her.
The mother, she said to me, there's a reason why God brought you to Adventure Dental. And I just washed my hands and I looked up. I said, oh, a reason? She said, you were here to treat my son. And she hugged me, and that just really touched me. So I do remember that moment.
By that time that patient was done with their treatment, she had about 6 other resources for that patient to go and finish the treatment that we were unable to do.
We are not just a provider or a teammate or a friend. We are a counselor and a source of respect for patients that truly need us.
And I found this outreach source for her, and they do fostering for pets for the homeless. And she cried in the middle of our hygiene bay. I mean, it was so important for her to be able to stay with her dog. You know, her husband's dog, that was her last piece of her husband. And for the girl, that was the last piece of her dad.
Everyone left the room with tears, even the patient. She wasn't very able to communicate, but her eyes said everything. And she was happy that we were able to do that cleaning, and the father gave me a big hug.
She was just very quiet, laid back, and shy. At the end of the conversation, I said, I want to tell you something super exciting. I said, did you know when you come to our office, you're going to have over 400 pairs of glasses that you get to choose from? And the little girl was looking down, and she finally looked up at me and made eye contact and said, that's so exciting.